So, looking at the distribution of the veins and arteries, so this is just kind of looking at overview. Most of the more specifics will be covered in lab. So usually what happens is for every vein there's an artery, or for every couple arteries there's a couple veins. So they're usually, if there's an artery going someplace, there's a vein taking blood away from that place. So a single vessel can have several names as it goes over kind of different anatomical areas. So for example, the subclavian goes kind of under the clavicle. When it gets in the axillary or the armpit region, it becomes axillary. And then when it becomes in the upper arm, it's brachial. So it hasn't branched, hasn't changed or kind of done anything. It's just going over different areas. And that helps because they're long vessels. So if I'm talking about the subclavian with someone else, then they know where I'm talking about, that I'm talking about here. If I'm talking about the axillary, then they know I'm talking here, and then the brachial here. So it just helps us know and orient ourselves, especially with kind of records and things like that, that I know based on this long vessel, I know I'm in this section or in this section or this section. So it just helps break it up. I always kind of explain, like driving on Florida roads, all of a sudden you are driving on one street, you keep going straight, you haven't turned, you haven't done anything, but all of a sudden the street name changes. So it's the same kind of concept that's happening. Tissues and organs are usually have several arteries and veins to them. So we'll have major ones that we'll name, but there's also smaller ones that usually come together. So most of the kind of way the blood travels is heart starts, that's the pump, goes to arteries, and then smaller, so large elastic artery to medium arteries to arterioles, and then goes capillaries to venules, medium-sized vein, large veins. So it kind of goes from largest to smallest, and then smallest to largest again. Most of them are going to pass through just one network of capillaries. So when it goes from the heart, it goes down the arteries, the arterioles. So it goes in the arterioles, then goes into a capillary bed, and then returns. We do have some examples where they'll kind of skip one or go through a couple, and we'll talk about those next. So the first example of kind of abnormal, so normally it's this pathway, the simplest one, it goes heart, comes down, goes through one capillary bed, and then venules back to the heart. Now the portal system is going to be two consecutive, meaning next to each other, capillary networks. So that's in this picture right here, this part. So portal system, it goes same, starts at the heart, comes down arteries, goes through one capillary bed, and then continues on and goes through a second capillary bed before it then returns to the heart. So a couple of examples of where this is between the hypothalamus and the anterior pituitary. We're going to talk about these main kind of significantly in the endocrine system, so hormones. They're going to be, the hypothalamus is going to send signals to the anterior pituitary. And so there's a portal system going and kind of connecting the two. In the kidneys, we're going to also see some portal system. And the other one is going to be the major one that we talk about, is between the intestines and the liver. So what that means, especially with the intestines, is so you're going and you're digesting and things are being absorbed into capillary beds in the intestine. Then they're absorbed and then they go to the liver. And then they go through a capillary bed here. So the liver is kind of looking at things, making sure everything's being processed, storing anything. So it's kind of monitoring everything that you're digesting. So it goes through the intestinal capillary beds and then goes through what we call the hepatic portal vein, which we'll talk about in lab. You'll see it. So it goes to the hepatic portal vein to the liver and then goes back to the heart. So that's going to be a major portal system there. Another kind of weird one is an anastomosis. We talked about that. That's kind of a branching or coming together between two vessels, not a capillary. So we have ones there where you can have anastomosis between veins and arteries. So this is this example where you have an artery coming in, but then all of a sudden you have all these branches going to a different capillary bed. So you can either go through this capillary bed or this one. And then on the other side, all the veins are branching and going this way. So bloods from both capillary beds are coming together to the one vein to go back to the heart. The arteriovenous anastomosis, we also considered a shunt, meaning it's going to just go around. So it's a detour, you can say. So the artery is directly connected to the vein and it bypasses the capillary. So this is that example right here, where the artery is coming in. You can either go to the capillary bed to go to the vein, or you can just take the fast route and go around and ignore the capillary bed completely. And so that's an arteriovenous because going artery to vein. Other anastomosis are going to be either artery to artery or vein to vein. So I talked about venous anastomosis. That's actually the most common that you see. There's a lot of little veins that are going to come off and kind of join together and then make a larger vein. So one kind of empties into another. And that's really important because if you have a lot of routes, say coming off of this capillary bed, you have this vein is blocked for whatever reason, then you take the detour and you go this way and you still make it to your end result. So even if route is blocked, then you can kind of go through and kind of come around this way. So you have a lot of different options. So that's why we worry less about a blockage in the vein, just because there's so many different routes that you can take versus not as common in arteries. So if you have an arterial blockage, it's more serious. Arterial anastomosis is two arteries are merging. Again, you can see it on this side of it where you're kind of merging all these arteries. It's going to have, again, same reasoning, alternate blood supply. So you can either go this way or you can come down and go this way. So you can go multiple routes. Coronary circulation has arterial anastomosis. Specifically, you're going to see it at the apex between the anterior intraventricular artery and the posterior intraventricular artery. You're going to see it. And you can see it in other places too. So coronary circulation is a common place. Also around joints, because specifically joints are going to need blood supply, but cartilage and things like that are not going to have the blood supply. So you can kind of branch around them as well.